we can imagine a possible scenario. If we think in a female patient, 60 years or 55 years old, that comes to your office and you ask her, okay, tell me about your pain. No, I don't have pain. I had hot flashes. Probably you can refer that patient to a gynecologist. But we are going to speak today about those different indications beyond pain. My name is Juan Felipe Vargas. I'm from Colombia, and I hope you enjoy this lecture. Let's remember a short review about the anatomy of this stellate ganglion block. Remember that it has sympathetic fibers from the head, neck, heart, goes to superior limbs, and through the first thoracic segments. The fibers ascend through the sympathetic chain and synapse with the superior, middle, and inferior ganglion of the sphenopalatine lung.